Today is all about apps that are gonna make your life way easier if you're a nurse practitioner, if you're a family care provider, or a PA, anybody who's gonna be taking care of people, managing medications, and coming up with treatment guidelines. So if that's you, stick around. I'll show you my favorite apps that I've been using in primary care and what I love about them. I'm Liz. If you're new to my channel, welcome. I make videos on becoming a nurse practitioner, nursing, being a mom, and doing that all at the same time. Craziness. So if you're interested in that, subscribe. I'd love to have you. So here are my 10 apps that I absolutely love and I use all the time in clinical. I have 2 months left in my family nurse practitioner program and whee, I'm so excited. And I have over the last year through talking to my preceptors, I've found a lot of apps that are super helpful, and apps are great because most of us, I mean, honestly, have a smartphone. I think apps are super helpful, and obviously as you get better and better at your practice, you're not going to rely on them as much, but they're great for, especially when you're starting out and you just need a little bit of nudge in the right direction. Or if you just want to ever verify something, like you're like, oh, I don't know if what that's gonna do. It's great to just verify it. All right, let's get into this. Number 1, Epocrates. I cannot say enough wonderful things about Epocrates. That is an app that goes over pharmacology. I've used that all the time in nursing too, when parents or patients are like, hey, like what's the interaction with this? Or what are the side effects? Like my kid has this, could that be like a side effect? And you can pull it up, you can see the pharmacology, the mechanism of action, how it's metabolized, what the side effects are, what the usual doses are. So the app is free for the general basic version, and that'll give you like what the meds are, the med interactions, dosing, how to start it, how to wean on, how to wean off. But if you pay for the upgrade, it's $175 if you are not a student. And that gives you guidelines so that you could almost do all of your management plans in, where you would type in like otitis media and it'll tell you all the guidelines, all the latest research, and it'll take you through like what's your patient like and help you decide what medicine and what dose to give. If you're a student, you can get it for $50 a year. I so recommend this. It has been a lifesaver for me just to point me in the right direction with a lot of people. Obviously, every patient you're gonna have your own management plan for, but this can just help you go down, like start down the right path, because that is so hard when you are starting out as a provider, is like, where do I even go? And it's all in one place. It's great. I love that app. I forgot to say, one of the other things that is great about Epocrates, gives you monitoring parameters. It will tell you the ICD-10 codes that you might need for coding the visit if you type in the ailment, and it gives you alternate therapies, which has been really helpful. So, I mean, a lot of times you're like, ooh, I really want to give them, azithromycin, but they have an allergy, and so you're like, it comes to a grinding halt. I find that very challenging as a new provider, is when people are like have allergies, because I have my set meds, in my head, and I'm like, I don't know what my second choice would be. It can help you with that. Less panic. The second app that has been really great is the Family Practice Notebook. This one is again free, and this gives you treatment guidelines based on categories of illness. So it has, you can pick like respiratory and then COPD, something like that, and it will give you the basic guidelines. So these I have found are not the most absolute up to date, but I use this a lot just to give me a guideline, and then if I want to, I can go look up, like the latest article within the last 6 months on what the treatment guideline is. But for the most part, for the major diagnoses, it will give you up-to-date information based on the best evidence. I use it a lot as just a reference, just to kind of point me in the right direction, like I said. So that one's great, and it's free. It's kind of like up to date, but the free version. Third is the CDC Vaccine Schedule. So this is great if you're both in peds or in adults, or doing both. It has for peds, it has the regular schedule. It has the catch-up schedule. So if you have a kid that comes to you and they've missed a couple, it has a schedule that will kind of bridge you to a normal one. It has all the adult recommendations. It shows you kind of the common side effects, like could you have diarrhea from this one? Could you have this? A huge aspect of this I love is the contraindications. So this will tell you like, hey, you can't have this one if you're allergic to eggs. You can't have it if you've had, a fever, a cough, whatever in the last so many days. That's been really helpful. Fourth app that I use a lot in practice, I didn't think I would need it, but that CDC STD Treatment Guide. I use this app all the time. Just treatment of, what different presentations could lead to, because everything's not going to be black and white. What kind of to look for in the slides if you're going to make a slide of it, what to treat with, what to treat if it's a recurrent versus if it's their first time, how long to treat for, if you need to treat their partner, if it's a reportable disease, all of the things like that. It's a good reference tool. Fifth is another CDC one, and I'm gonna look at the name because I never remember it. The USMEC USSPR. It's a contraception one. This one is also free. This will list for you different indications for contraception. So it doesn't give you the actual contraceptive pill that you need to give, which kind of stinks, but you can go back to Epocrates and just type in the category then at that point and you can get a name. But the app does give you, like, if you go in and you're like, hey, might this contraception method be a good choice for this patient, it'll show you like the benefits of it, the cons, and if you type in their age, a few facts about the patient, it will give you recommendations. So obviously, if they're smoking and all that, you're gonna wanna cut off their combined oral contraception earlier. And if they're trying to get pregnant, somewhat within the next reasonable time frame, you're not going to want to do Depo. So it just kind of gives you a heads up into things like that. And it has, again, all the basic information of like what are the major risks of each type, what are just general facts that you can share with your patients if you're having a counseling session on contraception. The sixth one is great, especially if you are in primary care, AHRQ ePSS, which is the Electronic Preventative Services Act. The U.S. Preventative Services Task Force, or the USPSTF, right? Oh my gosh, I never can remember that. All the preventative recommendations for primary care. So this one is great. You go in, you type in the patient's age, you put in a few demographic info about them, like do they smoke, I think, are they pregnant? And it gives you all of the A and B recommendations that you need to do as a primary care provider. So like, hey, are they up to date on their PAP? Do they need a low dose CT scan if they're a smoker? Are they due for a colonoscopy? All of those things, your annual depression screening. It just lists them all for you so you have it all in one place if your health record doesn't necessarily pull all that up. So that's a good one to just review before you go into the room. If you're having a health maintenance exam, you can go in and be like, hey, these are the things we really would also like to just kind of get taken care of. Next, the LDL-C Manager from the American College of Cardiology is an awesome one for calculating your risk of an ASCVD event. So does this person basically need to be on a statin? Are they at risk for having a stroke, an MI, anything like that? So how this app works is you type their age, their systolic blood pressure, if they're a smoker, their race, and I think like one or two other things, and it spits out their 10-year ASCVD risk score as well as their lifetime ASCVD risk score. And then it will give you a recommendation of like, does this person not need a statin? Do they need a low dose, moderate, or high intensity statin? And then it gives you recommendations on where to go from there. The cool thing is it also shows you, which I've used a lot with patient education, is their risk if they do modifiable risk factor management. So like lose a little weight, exercise, and start this statin. It shows you the risk that they're at right now for a 10-year event and a lifetime event, and then their risk if they do risk factor management, and then you can see how low it is. So, it'll say, hey, if you don't do anything and you keep doing what you're doing, you have a 75% chance of having an MI or a stroke in the next 10 years. But if you modify these risk factors, we start you on this medicine, your risk goes down to like 5%. And that has really been helpful. People are like, oh, geez. So that's been really helpful for statin management. Also, I just want to point out, I completely forgot, all of the ones we've talked about so far are totally free, except for the Epocrates one, which we couldn't upgrade, but everything so far has been free. The AACE algorithm for diabetic management, also free, is great. So the ADA has an app too, but it's not as updated for whatever reason. They haven't updated it since like 2014. This one was updated, I think, in 2016. So this one's the one I like for diabetes management. It has great charts for how to proceed with, like, this is your patient's A1C or their glucose, and like how to initiate therapy, how to step it up. It just gives you really nice flow charts. It compares and contrasts the different oral medications. It tells you kind of how to initiate insulin. So for basic diabetic education, hey, my patient needs this, they need to go, we're starting all this therapy, it's a really helpful tool, especially the med comparison, because you can kind of see based on what they have going on, like what would be a good choice for them if you're adding on a second med on top of metformin. And the last two apps I like them. The First one is the Gold, G-O-L-D, for COPD. That was $2.99, and it gives you the COPD management, and it updates with the latest guideline updates on how to stage the patient's COPD and what medicines to give them, side effects to watch for, how to do exacerbations, things like that. I really have found that one to be helpful. And the 10th app I have been using lately is the Pedi Quikcalc, and that is $1.99 on the App Store. And that is helpful because you type in the patient's age, but more importantly, their weight, and it will calculate the dose for you that you need on a med. And it's just an easier thing than it'll give you like, hey, if you want it in divided doses, this, how much a day. It makes it really easily for quickly filling it in if your computer doesn't do it for you. And it also has a part of the app where if you just type in like an average 5-year-old, it'll kind of spit out a general number for you in case you for some reason don't have their weight. Then you can go on like based on the 50th percentile, this is probably the dose that would be the most accurate for this kiddo. And another thing that's really good with that app is it gives you how the tablet comes. So if you're trying to, with kids, sometimes it's hard to get the right dosing, like to figure out how do I actually give this to you. So like if it's 25 milligrams, but it only comes in, 10s or something, how are we going to get you to the 25? It'll tell you ahead of time so you can know how to dispense it from the pharmacy. Those are my 10 favorite apps. I will list them all down in the information below. They're super helpful for primary care, but I think no matter what, most of them would benefit you if you are in any way a provider. If you like this video, make sure to give it a thumbs up. As always, if you have any questions, comments, apps that you love, please let me know if you have apps that you love that I don't know about yet, because I graduate in 2 months and anything to make life easier at this point would be wonderful so I can learn from it. So if you have any recommendations, please let me know. Thanks so much for watching, and we will see you next time. Bye.